In the spring, some of the information held in those records will be uploaded to a giant database. It's a scheme called care.data. People can opt out if they want, though, as we heard on Friday, a poll suggested only about a third of people say they've received a leaflet about the scheme. Nearly half of those questions said they didn't know about the care.data scheme at all, raising fears that people were ignorant of their right to opt out. The Department of Health declined to join us on Friday, but Stephen Dorrell, who chairs the Health Select Committee, joined us to reassure people that Parliament knew what it was doing.
Parliament has made a decision that there is an interest on the part of each individual patient and there is an interest on the part of the population as a whole that this programme does go ahead. Parliament makes decisions every day on behalf of voters, and Parliament has made, in my view, absolutely rightly, the decision that if we want to deliver high-quality healthcare, we have to go beyond looking at discrete episodes of care. We have to treat people, not just as episodes of care.
We had a huge response, lots of comment, opinion and many questions, including some basic questions about how it might work. So we invited the Department of Health onto the programme. We even put a leaflet through their door, but the answer was no. We also asked NHS England if someone there could answer our listeners' questions, but the answer was no. So I'm afraid we can't bring you the official NHS or government view of the scheme, but we did want to try to bring you some answers. So our health correspondent Adam Brimelow is here, not speaking on behalf of the government, and we did ask the government, but there we go. Sandra Douglas first. It says there are circumstances when the NHS can compel your GP to release information even if you've opted out. She's emailed the NHS. She's got 2 examples of exemptions: spread of infectious disease and whether a serious crime has been committed. She's asked for a full list. What can you tell us about exemptions, Adam?
Well, Eddie, there are 3 scenarios, really, where identifiable data can be passed on. The first, as you'd expect, where there's been explicit consent from the patient. And secondly, in cases where there's a large-scale, important clinical trial, researchers can apply for access to identifiable data, and there's a confidential advisory group that's made up of doctors and researchers and academics who make a recommendation to the Secretary of State on whether to give the go-ahead. And the third area, which is the one really that Sandra's talking about, these are the public interest cases where there's a public health threat, such as an epidemic or an investigation into a serious crime. This is where data can be pulled out of GP or hospital records.
Jackie Fernley asks, why do we have to discuss with our doctor any wish not to have our medical records shared? Surely there should be a form we can fill in or simply an email.
Well, people are being advised to go to their GPs if they're interested in opting out. In some practices, though, we've been hearing that people have been given the wrong forms or practice staff just aren't aware of the scheme. So if people want to download an objection form, they can from an organisation called Med Confidential, and they can fill that in and post it, but they shouldn't need to see the doctor, the GP, to opt out.
All right. Karen Poley wonders why we're opting out and not opting in. She says, didn't the EU introduce legislation a few years ago for people to make positive decisions rather than a default position on this kind of thing?
Well, I think Karen is referring to a proposal that's being discussed in the EU at the moment. This is a proposal to harmonise data protection across the EU, requiring explicit consent for using identifiable data. Now, that could get in the way of the care.data scheme. It's under negotiation, though. It's EU level, and we'll have to keep a watch on that.
Madeline Richardson, please ask whether all patient information will remain totally anonymous and unidentifiable, and to whom it will be available. She wants to know about all the people who can see it. And Alistair says, hasn't someone shown in the US how anonymised medical histories can be used backwards to identify individuals by cross-referencing other readily available information?
Well, just to deal with that second point first, there's never been any denial that there's a possibility that people will be able to be identified on the basis of this data being matched up with other sets of data. But it will be illegal to do that, and there'll be criminal penalties to pay if people try. Just in terms of the different formats that data will be made available, first of all, there will be a completely anonymised format that could be used to compare performance of services in different parts of the country. Secondly, and this is the most controversial area, there's what they call pseudonymized or proxy data. That involves family history, vaccinations, diagnoses, referrals. This is the stuff that's going to be uploaded from GP records, But the identifiers, things like the date of birth and the postcode, will be taken out and replaced with code so that researchers can follow patients right through the system without identifying them. Now, this data won't be published, but it's likely to be made available under contract to approved organisations. Initially just the NHS, but in time potentially private companies.
Lots of people had concerns about insurance and whether somehow this information could end up in the hands of the insurance companies and affect us in all sorts of ways.
Well, there's no blanket ban on insurance companies per se getting hold of the data, but it's about what they use, what they do with the data. They have to demonstrate that it's for patient benefit, and then they will be policed in their use of that data, and if they abuse it, then there are criminal sanctions.
All right, Adam, thank you so much for that. Our health correspondent, Adam Brimelow, doing his best to answer those questions in the absence of the Department of Health.